Benign paroxysmal positional vertigo, or Bppv for short, is a common form of peripheral vertigo attributed to canalithiasis or calcium debris, most commonly found within the posterior semicircular canals. Higher frequency of Bppv have been reported in patients with giant cell arteritis and is independently associated with age, migraine occurrence, prior head injuries, hypertension, hyperlipidemia, and stroke. And if it's not idiopathic in the remainder of the patients, these symptoms are usually residual effects of a variety of vestibular pathologies such as Meniere's disease, vestibular neuritis, ear surgery, herpes zoster, and inner ear ischemia. Patients will have no other neurological complaints and may have evidence of prior inner ear damage, and approximately half of the patients complain of imbalance between attacks and even after treatment. Episodes may reoccur periodically for weeks to months without therapy. Observing nystagmus and complaints of vertigo during the provoking maneuvers, such as a Dix-Hallpike maneuver, solidifies this diagnosis. This maneuver is done with the patient sitting. The neck is then extended and turned to one side. The patient is then placed in the supine position rapidly so that the head hangs over the edge of the bed. The patient remains in this position for 30 seconds, and if no immediate nystagmus has occurred, the patient is then sat back up and observed for another 30 seconds for nystagmus. If nothing occurs, then the maneuver is performed again, but on the opposite side. If history, symptoms, and the maneuvers point towards Bppv, the treatment consists of more maneuvers, actually. The modified Epley maneuver is our initial go-to. This kind of looks like a modified Dix-Hallpike maneuver, but when the patient lays down and waits for 30 seconds, they then turn their head to the opposite side without sitting back up. Then they wait for 30 seconds. Then they turn the rest of their body after that and wait another 30. And then they sit back up. This should be performed 3 times a day until they're free from vertigo for at least 24 hours. Usually in this condition, medications aren't useful for most of these patients. And though reoccurrences are fairly common, they should continue to respond to this self-treatment with these maneuvers.